Welcome, dear audience, to the second webinar in the European Observatory's Health Systems Performance Assessment Spotlight webinar series. My name is Deepa Rajan, and I'll be moderating today's session together with my colleague, Erica Richardson. The webinar series today aims to showcase articles from our special issue of the journal Bulletin of the World Health Organization. This was edited by ourselves at the European Observatory and WHO, and it is on health systems performance. We'll put the link to the special issue in the chat box. We'll be particularly looking at an article within that special issue today entitled Resilience Dimensions and Health Systems Performance Assessments in the European Union, and the specific link to that article will also be put into the chat box. So today we'll be focusing on the health system goal of resilience, one that has risen in prominence and importance in policymaking circles, especially since the COVID-19 crisis. So much so that they're now integrated in various health systems performance assessments across European countries, as one of our keynote speakers, Milena Vainieri, will present to us. She's the lead author of the article I just mentioned. And one of the reasons we, the editors of this special issue, were so interested in this manuscript by Milena and colleagues was because the reigning discourse in the literature on resilience is strongly focused on conceptualizing resilience, offering a definition for resilience, a definition that would lend it a meaning that is not only linked to emergencies and preparedness, but also inherent to the health systems itself, that is much more linked to the health system functioning. The Observatory also contributed heavily to this literature discourse, and as you will see with various links to some of our publications that we'll put into the chat box now. But this article, which Milena will be presenting, specifically looks at the practical side of resilience. How are countries in the EU actually measuring it? Not separated as an isolated piece of work or an isolated work program, but actually embedded in and part of a country's health system's performance monitoring. And so by doing so, by looking at those indicators, we also get a very good sense of how countries define resilience in practice in health systems. So we have an exciting speaker lineup for you today. We exceptionally have not one, but two spotlight speakers. And together they will not exceed 15 minutes, though, to keep you up to get you up to speed and to frame resilience for you. Our first speaker, Marina Karanikolos, will frame resilience for you within the health system's performance paradigm, while the second speaker, Milena Vainieri, will give you the overview of how European countries are actually practically measuring it. And Marina, my dear colleague and staff member of the Observatory's London Hub, is based at the London School of Hygiene and Tropical Medicine, and she is also an honorary assistant professor in LSHTM's Center for Global Chronic Conditions. And she completed her PhD in public health at Erasmus in Rotterdam. And Milena, I'm going to introduce her as well, as she will go on right after Marina. Milena Vainieri is a full professor of management at the Sant'Anna School of Advanced Studies in Pisa, in Italy, where she's been leading the management and healthcare laboratory since May 2019. And she also is the scientific coordinator for the performance evaluation system for the Tuscany region since 2014, and of the Interregional Performance Network since 2019. So over to you, Marina, and then Milena.
Thank you very much, Deepa. So today I'm planning to talk about resilience and how it can be addressed through health systems performance assessment lens in a bit more operational and practical way. And there are many ways to conceptualize resilience. Here I would like to focus on a couple, and I find this particularly helpful because they fit well into the HSPA thinking. In the policy brief in 2020 that was led by Professor Steve Thomas from Trinity College Dublin, we defined resilience as health systems' ability to prepare for, manage, and learn from shocks. And slightly after, this definition was expanded by the EU expert group on HSPA, adding the notion of maintaining performance and coming out stronger as a result of a shock or a structural change, which could be slower, but just as devastating. Both definitions don't just look at how health system is coping during the shock, but also what happens before and after the shock. And here is the WHO Observatory Global HSPA framework, and there will be links in the chat to the book and the policy brief that describe it in lots of detail. But what we want here to see is how resilience is shown here. So on the left-hand side, we have the health system functions, the usual ones: governance, financing, research generation, service delivery. And from middle to right, we have intermediate objectives and the final health system goals. So the health system performance assessment means measuring how well health system manages to attain those goals. And when it keeps doing this well throughout the shock, it means that health system is resilient. So shocks vary, and also the processes within the health system vary. So resilience can be captured in those linkages between health system functions and outcomes. And here you can see it illustrated as the red disruption line in the performance pathway. But basically, it could be anywhere within those linkages. Resilience or lack of it can manifest in various performance indicators. And here is an example that looks at access to services during the economic crisis and austerity in Greece through unmet need for medical examination due to cost. So this is when people say they need to see a doctor, but didn't do that because they couldn't afford it. And the blip in the rise in unmet need in the poorest quintile, that's the red line, in 2016 is strikingly obvious. But even if you look at the share of total population in the gray line, you can see how access keeps deteriorating up until 2016. And during that time, Greece was in the depths of economic crisis coupled with major austerity. And lack of resilience manifested in rapid worsening of access to services. But we want to know why this happened and what led to improvements in 2017. So in this case, entitlement to health coverage in Greece is linked to payments of contributions, and rising unemployment and falling incomes meant that people affected and their dependents stopped being eligible for health coverage. So by 2016, unemployment was well over 20% in Greece, and more than 2 million people lost health coverage. And this issue was known but couldn't be addressed by small fixes until 2016, when the government made actually major change and established a separate fund to ensure people who are unemployed face financial difficulties, they remain covered. So it's through some of these outcomes that we can see and we can identify those weaknesses that make health system vulnerable to specific types of shocks. And in this case, the underlying weakness was in financing. And we can explore this pathway in a little bit more detail. So here it's the same framework, just the version that zooms into financing and shows more layers of what health system needs to do to perform well. Coverage design is determined in the governance of financing, that's in the blue box, and a well-performing health system coverage has to be comprehensive. So in case of Greece, this was a pre-existing gap there that meant that unemployed people would lose coverage. And the issue had always been there, but the financial crisis exacerbated it dramatically. So fixing it, on the other hand, would not only improve the comprehensiveness of coverage and access to services, but also would be beneficial and would have an effect on the aspects of financing. So if done well, it can increase and stabilize revenues during the economic shock, and also contribute to equity and efficiency of financing, and ultimately improve health system performance overall. And here is another example of the use of HSPA framework to assess and strengthen resilience. This is from a project funded by the European Commission that Observatory and OECD completed last year. Here we combine HSPA framework with the shock cycle, so we get a blueprint of health system functioning before, throughout, and after the shock. And then we use shock scenario, and it could be any shock, but it should be relevant to the health system so we can test resilience. The test itself brings together people who have knowledge and practical experience of what happens if the scenario materializes, or whether measures currently in place are enough to cope with this specific shock and withstand it. And ultimately, this methodology aims to identify actionable health system weaknesses and ways to address them. Again, all the details are described in this lovely resilience testing handbook, and it's on our website. And here, so it can show you how exactly you can do it. But Finally, here is the example from the pilot that we did on resilience testing in Finland. And we are very grateful to colleagues from the Finnish Institute for Health and Welfare who worked with us on this. And this matrix is representation of health system functions and shock stages. Shock that was chosen for Finland was pandemic, but it wasn't COVID, but something that predominantly affects children and puts a major strain on services. So it's kind of combining the existing knowledge with a new twist that is needed to consider aspects beyond what is already known from COVID. And I've put some examples of the areas that came up and were identified during the resilience testing. So things like embedding mechanisms for collaboration across and beyond the health system, because the danger was that severe shocks affect multiple aspects of life, but once they pass, people go back to their silos. This structure was also helpful and useful to address recovery, because when everybody is relieved that crisis is over, then lessons get forgotten. And for example, addressing more systematically issues like which measures were beneficial and should be kept, or how long and at what point do we switch for deprioritization of crisis services, or who is responsible for funding that may be needed to understand and implement those lessons learned. So I hope this provides a good overview of our thinking on resilience in health systems performance. All of this is published, including the book on and the policy brief on HSPA framework and the briefs and handbooks on resilience strengthening. And we're currently working on the next brief that will bring together evidence on health systems resilience more globally. So watch this space. And thank you very much for your attention. And I will hand over to Milena for the second part of this keynote. Thank you.
Thank you, Marina. It's a great pleasure to have this opportunity to present the article that I co-authored with Alessia Caputo and Alessandro Vinci, as suggested by the first part of the title, Resilience in Action. We aim to explore resilience from the perspective of the practitioner. So while many scholars have defined this broad concept, as Marina was shown before, we chose to contribute to this field by adopting an inductive approach, the practice-based approach, analyze how EU countries assessed resilience in the HSPA, Health System Performance Evaluation. So in the next slide, you can, this is the idea to look at how the countries has measured resilience. And in the next slide, I just brought you some slides related to the concept of resilience, which seems really a word that comes into the real vocabulary of the society. So it was sometimes regarded as the word of the year, as also in this appear in this blog of Harvard Business Review. So that's also why we decided to look at how the countries measured actually resilience, considering that this concept was really internalized by not only experts and academics, but also by the broad society. So in the next slide, just few examples of how, from the measurement perspective, how resilience was introduced. Also the idea to measure pandemic and what happens during the pandemic, and how the countries were able to be resilient to the first stage of the pandemic. So through, for instance, the dashboard. So in that article, there were more than 30 countries developed their own dashboard in order to count how many COVID-19 tests were used, and so on and so forth. On the left of the slide, another way to measure resilience or better preparedness has the checklist and self-assessment checklists, such as the ones provided by the ACDC. So in our article instead, we examined, in the next slide, we look at at the HSPA, looking for a documental analysis using the broad engine of Google Scholar, but also some pivotal book and article providing back the information of the HSPA of the countries. We identify 18 HSPA, but only less than half of these HSPA use in an explicit way the domain of resilience in their HSPA. It was not surprising, even though in 2018 resilience domain was introduced in some of country profile at the EU level. In terms of HSPA, this term appeared just after the pandemic. So these are the 7 countries that we analyze more in depth in order to understand how they use and which are the KPI they associate to the term of resilience. So diving deeper in the next slide, diving deeper into the measurement aspect, we analyze resilience using the expert panel definition. The second one proposed by Marina. So we look at the dimension, sustain required operation, resume optimal performance, transform healthcare structure and function, and reduce the vulnerability for future shocks. And then, so going ahead, because there is some animation, so we can say that the first 3 part can be used during the outbreak in the first period after the emergency. So considering the aspect related to vaccination coverage, of COVID vaccination coverage, the number of beds used for intensive care units. The last 2, so again, transform the healthcare structure and function and reduce the vulnerability for future shock, where can be dimension, as also Marina said, that can be used after the pandemic or before the pandemic. So preparing also the health system to cope with the next epidemic. So in terms of measurement, we discovered that we classify and group the KPI used by these 7 countries, 6 countries better, into 6 groups. So going ahead, the 6th group were capacity to address unmet needs and maintain outcome that could be included into the first 2 sections of the definition of the expert panel group. The capacity to protect vulnerable group, which is one of the few dimensions that look at how to reduce vulnerability for future shock, that include also not only COVID-19 vaccination rates, but also in general vaccination rate for flu, for elderly, as well as other vulnerable groups. The capacity to manage and acquire and use resources, and capacity to have trained and prepared staff in place, capacity to utilize digital health, which is one of the, let's say, new domain that could be associated to resilience, and capacity to strengthen primary healthcare services. So just looking at the picture, we can see that strengthening primary healthcare services could be considered one of the key performance indicators that all the HSPA use it across the years, also from 2020 to 2022, covering all the domains of the theoretical definitions. So going ahead, we can say that if we want to use this information or this insight also to use this KPI to prepare the health system to cope with the next epidemic, we can focus on 5 of the 6 group we identify. In the next slide, we can see better the 5 group that goes from the second to the 6th one, and most of them refer to the idea to transform healthcare structure and functions, because they use indicators related to the development, for instance, of digital health, for instance, the use of telemonitoring system, televisits, and other aspects of digital health, but also other aspects related again to primary healthcare. So we can say that these are dimensions, interesting, and indicators that can be used in the new normality stage or inter-pandemic, like some public health scholars are used to say. And the last slide is just bringing you one of the comments, and the takeaway information related to this article is that many resilience-related KPI keep to be measured, although most of HSPA could not, again, label this type of KPI as resilience domain. So it's in a provocative way, maybe sometimes in terms of measurement, it is only a matter of labeling what is resilience. So thank you for listening, and thank you for the support to Erika.
Thank you, Milena, and thank you, Marina, for framing resilience within the health system paradigm for us. So Marina showed us how resilience is about absorbing shocks during the crisis, but also what happens afterwards, which is maintaining that performance, and even better, learning from the crisis experience to transform the system into something better than it might have been before. And Milena, your presentation has given a strong sense of what the different health system functions or sub-functions are particularly targeted for measurement, how countries see it in practice: workforce, digital information systems, primary healthcare. Now let's do a deep dive into 2 countries' health systems performance assessments and how they examined resilience. We'll hear now from Belgium and from Italy. That will be followed by reflections from the European Commission's Reform and Investment Task Force, SG Reform, as they're called now, formerly DG Reform. The Reform and Investment Task Force has been heavily supporting investments in strengthening health systems resilience over the last few years as part of EU countries' health reform efforts. So let's start with Belgium. As a best practice country on performance assessment, Belgium's KCE, or Knowledge Healthcare Center, which is a public research body funded by the federal government, is tasked to do the country's HSPA, Health Systems Performance Assessment, every 4 to 5 years since 2010. The latest report just came out a year ago and included a new dimension and chapter on resilience. And we're privileged to hear from the very person responsible for that chapter, Mélanie Lefebvre, who is an expert in health services research at the KCE. Over to you, Mélanie.
So, as you said, we included health system resilience in our latest HSPA report. So actually, what we did is that in 2023, we revised the conceptual framework of our HSPA report. And within this revised framework, we included resilience as one of the dimensions. And we really published the results in the 2024 report. So here are the reports, but the links will be in the chat box, I guess. Yeah. So if you are familiar with resilience, you are familiar with this graph. But if you are not, that's actually the basis for the theoretical framework to analyze resilience that was developed by the expert group Marina or Milena was talking about. And on the vertical axis, you have a performance or an HSPA indicator. And this indicator faced a shock. And what we wanted to do with this theoretical framework is to really have a quantitative analysis of resilience. So what we did is, for a number of indicators, we measure some key data point, which was the pre-shock value, the worst value, the best value, and the most recent value. And we define resilience as the ability to minimize the magnitude of the shock, which is defined as the difference between the pre-shock value and the worst value. Resilience is also the ability to maximize the magnitude of the rebound, which is defined as the difference between the best value and the worst value. But resilience is also the ability to minimize the length of the disruption, which is the time between you observe a negative shock and the moment you start observing a bouncing back effect. And resilience is also the ability to minimize this time before recovery, which is the time between the negative shock again and the moment you observe the pre-shock value again. And so to do so, we had to select some indicators. And actually, we realized, and it was also clear in Milena's presentation, we realized that any HSPA indicator could be a resilience indicator as long as you analyze it in the context of a shock. And so we chose one shock that was obvious at the time, that was the COVID-19 crisis. And in that context, we select some indicators. We use three selection criteria. The first one is relevance. We only selected indicators which value could potentially be affected by COVID-19. Then we only selected quantitative indicators. We ruled out qualitative and descriptive ones. And one of the most important criteria was the data availability criteria, because we needed repeated data to be able to measure the pre-shock value, the worst value, and so on and so forth. So we ended up with 11 indicators. And for each of those indicators, we presented a graph of that kind. So this one is an indicator about surgical hospital activities in Belgium as a percentage of the activity that is expected in a non-crisis period. So obviously, the pre-shock value is 100%, but you observe a sharp drop at the beginning of the pandemic, so during the first wave. The best value is over here and the most recent value over there. From that, we can calculate the length of the disruption, which was 9 months for this indicator, because you observe the bouncing back effect here. Also, you already have a bouncing back effect here, but it's not really sustainable. This one is more sustainable. And we calculated the time before recovery, which was 13 months in that case, because here you reach back the pre-shock level. So we did that for the 11 indicators, and we summarized this in a huge table. So this indicator here is the one from the previous slide. And for each indicator, we presented the 4 values, so the pre-shock, the worst, the best, and the most recent, for Belgium, but also for each of the 3 Belgian regions. And using this information as well as the graphical analysis, we were able to put a color for each indicator, which could be a green, yellow, or red. And this color is kind of an assessment of how Belgium was resilient to the pandemic, to the COVID-19 crisis regarding this particular indicator. And you can see that some indicators are in yellow, but we had some green, but also some some red indicators. So those are important warning signals. Thank you very much.
Thank you, Melanie, for really sticking to time. Really fascinating how you looked at those indicators in terms of what happened before the shock, during the shock, and after the shock. And it goes back a little bit to Milena's question of, can you take any indicator and just look at it over time, and any HSPA indicator or not? On the one hand, yes. On the other hand, it's quite telling which ones countries then actually choose in the end and why. You mentioned data availability, so I'd be curious to know, maybe later in the discussion we can hear if that was one of a very key criteria. Otherwise, from Milena's paper, we see that there are certain common areas that all countries seem to look at, like workforce, like essential surgical services, vaccinations, etc. So it'd be interesting to hear, and maybe we can discuss more later about that primary healthcare as well during the discussion. So thank you so much. We'll now move to Italy and see how they measure resilience in their performance assessments. Federico Vola is a healthcare management expert specializing in performance evaluation. He's the head of research and development at the Casa Cardinale Maffi Foundation, and was previously a researcher at the Sant'Anna School of Advanced Studies in Pisa, and he holds a PhD in healthcare management. So Federico, over to you. If you could come on video and project your slides and tell us about how resilience is measured in the Italian context. Over to you.
Diva, thank you. Thank you very much indeed. Over the next 5 minutes, I'm going to try to share with you a snapshot, of course, of the HSPA tools, the Italian HSPA tools, and if and how they eventually encompass the resilience as a domain. Before starting, let me just go backwards, just sharing what happened before COVID-19. So in Italy, let me say that we had 3 main HSPA tools. The essential assistant levels of care. It's the tool you see on the left-hand side. It is managed by the Ministry of Health. Then we have the AGENAS one. The AGENAS is an independent agency jointly led by the Ministry of Health and the Italian regions. And on the right hand side, you see IRPES. IRPES is the third HSPA tool jointly led by Italian regions and Scuola Sant'Anna. Before COVID, actually, they shared one key characteristics. Resilience was not part of any of them, at least explicitly not a domain included in any of them. And then COVID-19 kicked in. So basically, of course, they had to react. The Ministry of Health one, so the EL, actually reacted by suspending the tool per se. So for a couple of years, indicators were not computed at all. So the system was kind of freezed for a couple of years. The first one that actually reacted was the IRPES, so Italian regions plus Sant'Anna. And they reacted, or it reacted, by actually including a dimension specifically focused on resilience. It was made by about 60 key performance indicators. It took an approach that is very similar to the Belgian one that Melanie just explained to us. So basically, resilience was conceptualized as the difference in volumes in 2020 compared to 2019. So basically, the ability of each healthcare setting in not suspending not deferrable procedures, such as surgical procedures for breast cancer. So for each indicator in 1 year time, basically each health authority in each region was benchmarked against the others in their ability not to suspend procedures or to rebound. So each region had their own resilience actually assessed, conceptualized, as I said. The third tool, Agenas. Basically, Agenas leveraged this approach. Agenas actually computed a kind of 20 indicators, basically adopting the same idea. So comparing 2020 volumes against the 2019 volumes. For instance, for cervical screening for oncological care. This is an example. This is Lombardy. You know, it's a region harshly hit by COVID, and you can see the blue dot is how each region performed against the average, the Italian average. For instance, we were mentioning cervical screening. They registered a kind of a 70% reduction compared to 40%. Actually, Agenas made one step further, and again, it's very similar to the Belgian case, because Agenas actually tried to measure resilience in each wave of COVID in 2020. So in order to assess how different regions were or were not resilient during each phase. So basically adopting different strategies in tackling COVID-19 and in proving to be resilient. So this is my snapshot. Milena and I actually wrote a contribution in a book on this subject. So I'm of course referring to this chapter should you have interest in deepening any aspect. And let me thank you again for your attention, and I'll stop here.
Thank you, Federico, for that very brief overview. And it's really interesting how it's very similar to Belgium, as you say, where you look at what happened before, you look at, and then you measure against a benchmark and see what happens during the crisis and after. A lot of focus in the indicators on the service delivery function, on prevention, primary care, also specialized care with oncology and cardiovascular. Interesting that neither in the Italian case nor the Belgian case, in terms specifically of the indicators, that we see less on financing and governance specifically, although they are covered mostly in larger health systems performance assessment, but not so integrated into the resilience measurement. So that's maybe something we can pick up later in the discussion. Now we'd like to hear from the European Commission. We're privileged to have Simone Boselli on this panel, a policy officer in the European Commission at the Reform and Investment Task Force, SG Reform. Simone joined the Commission recently, about a year ago, and works on the TSI project, the Technical Support Instrument, which he'll be telling us about. He has a long background in the Brussels policy environment, otherwise working for Brussels-based NGOs and consultancies. So Simone, over to you. Tell us about the TSI and SG Reform's work supporting member states to strengthen and measure resilience.
Thank you very much, Deepa. I hope you all hear me well. Please let me know if otherwise. First and foremost, as an Italian living in Belgium, I'm quite pleased that both Italy and Belgium are at the forefront of including resilience and trying to assess how resilience can be measured within their health system. And I can testify, definitely, having gone through a major routine surgery during after the third wave of pandemic, that wasn't postponed, at least here in Belgium. What I wanted to talk to you briefly today is what has been the role of the technical support instrument and its predecessor, the EU structural reform support, in empowering member states in adapting and adopting HSPA framework to their national situation. The technical support instruments has been since 2021 an instrument that supports member states in their reform processes by providing technical expertise. It's a demand-driven instrument, and member states can apply for this technical support at any stage of their reform process, in line with European priorities and their own national priorities. Strengthening a health system has been an overall priority for a number of years, and not to mention already the previous communication on strengthening health systems from the European Commission, but also after the COVID-19 pandemic. This has included providing support to individual countries in tailoring HSPA framework to their own priorities. To date, 7 countries in Europe have completed support projects financed by the technical support instrument or its predecessor, with 2 additional countries that are currently receiving their support. As the HSPA is possibly considered the state of health of the health systems, resilience is consistently being integrated in as one of the main objectives or goal of setting up HSPA framework in the cases that we have supported, alongside, in most cases, equity and efficiency. You mentioned that we have recently now called SG Reform, or the Task Force on Reform and Investment. As you know, with the introduction of the Recovery and Resilience Facility after COVID, support has also been requested and provided to strengthen health systems. 75% of member states have accesses the 44 and a bit billion euros provided by the RRF to integrate their efforts, particularly in investing in healthcare digitalization. And of course, we have heard from colleagues before that the quality of the data that is provided is essential in measuring the resilience of the health systems, but also investing in infrastructure and the modernization of the health facilities. Now, one other point that I wanted to really stress, particularly when it comes to identifying the indicators and monitoring the resilience of the health system through the HSPA framework, is at the definition stage of the indicators, and particularly maintaining a strong leadership and an active engagement of all actors along the health system chain, as to make sure that all of the data are properly integrated into the framework, so that effective measurement can be done. And particularly, I would like to stress that as we continue to move forward with the technical support instruments, or at least until the end of the current multi-annual financial framework, the focus will continue to be in strengthening health systems, and therefore support can be provided once again to strengthen the health system monitoring that have been put in place so well in the past few years. Thank you very much so far, and I look forward to the discussion that comes. Thank you.
Thank you, Simone. Yes, we see from what you just said that there is great member state demand for support in this area, for integrating resilience into health systems performance assessments. Let's go straight into our discussion session. If I could have all the speakers put on their video, and I hand over to Erica, who's been looking at the chat box. What are people saying? What are the discussions about? What are some questions for our speakers?
So yes, thank you very much. People have been very kindly sharing links to other resources in the chat as well. So please do take a look at those. Looks like there's some very interesting stuff going on in Ireland, but some really good questions as well. So one of these is maybe for Marina, but it's to do with frameworks and how the frameworks fit together. So how does the WHO resilience framework and the WHO health performance framework fit together? And then maybe a question for sort of Melanie and Federico. How much do these frameworks actually influence policy making at the country level? But then also, and this was specifically for Melanie, but I think it actually cuts across all of the speakers potentially, is there potential for predictive use of these resilience indicators to support, for example, emergency response planning? And this is I like these ones, sort of a hypothetical one. Are there any indicators that may not be available, but could be important in assessing resilience? So what would you include if you could? Was there anything you didn't have the data for, but if you had it, you'd have really wanted to include it? And then a question about now that we're post-shock, hopefully we're not going into a permacrisis. We're now post-shock. How can we continue to measure the resilience dimension? What about using mid or long-term metrics, particularly around quality of care and outcomes? So quite a technical one there. And there are more in the chat, so please do keep them coming in. Hopefully we'll get a second round in.
Lots of questions there. Does anyone want to volunteer to take one of those questions to start off with?
I can do the frameworks.
Go ahead, Marina.
Well, so in terms of HSPA framework, when we were designing it, there were lots of consultations were going on, and we looked at lots of different elements. So resilience is only one element within the framework that we need to account for. But then I think WHO has actually several things on resilience. There's a toolkit, there's something on climate, there's something on resilience strengthening. There are a lot. So, but the idea is that if you are trying to look at resilience within HSPA, then HSPA framework can help you to map it. And what I was pleased to hear from many of the speakers is that, you know, this idea that any indicator could be a resilience indicator, it kind of agrees with it. So because it depends on the crisis, it depends on the circumstances and on health system, on where you want specifically to conceptualize your resilience. So I think overall, they are quite complementary, but there can be some specificities in terms of the application, operationalization, or even a specific shock. Thank you.
Melanie,
Yeah.
go ahead.
Maybe I can answer regarding the question of about the indicators we were not able to include. Actually, what we did on top of the analysis I just shown is that for 20 other indicators in the HSPA report, for which we didn't have repeated data, we did a pre-post analysis to show the impact of COVID without doing the full resilience analysis. So that's a start to include some indicators without repeated data. But doing so, and on top of the 11 indicators, we were able to touch a lot of different domains, including workforce, primary care, hospitals. I mean, we were able to cover a lot, but still we had the feeling that some indicators were missing because of the lack of data. For instance, we had no indicator about the personal equipment, so mask and so on. And we had the feeling it was important during the COVID crisis, but we had no data about that. Or the ability to quickly reallocate government funding, or to also to quickly change the workforce, the ability to switch from one, I mean, to extend working hours, or I don't know. So the ability to change, we didn't have data about that. So we had the feeling some indicators were missing, but that's mainly because of the data.
Very interesting, because I see there that some of the issues around financing, for example, come in, or governance, which at the moment from the indicators that we see used for resilience are missing. I'm really focused more on service delivery. Anyone want to take one of the other questions? Do frameworks really influence policy, for example, the predictive use of indicators? Federico, Milena, anyone?
Yeah, sure.
Go ahead.
Actually, let me say that basically it has not directly, but indirectly quite a mediatic impact. And so indirectly, it had a kind of political impact. So those data, not exactly those data, but basically this approach to data actually was quite spread in the news. So indirectly, it has a kind of a political impact. And let me just share one more consideration. In what I actually probably learned in this parenthesis is that measuring resilience requires having resilient HSPA tools. So this is the main challenge. So in order to have actionable tools, you need as an evaluator to be brave enough to be able to basically challenge yourself. I see that in Italy, for instance, now the main challenge is basically moving toward resilience as a way of measuring the recovery fund. That is the great challenge in the Italian healthcare system. So how money, European money, is spent for improving our system. So this is the consideration that I wanted to share with you.
Thank you. So this also underlines the point that we need HSPA. We need health systems performance assessments to be done on a regular basis to have an underlying basis of very good data also over time that can be drawn from to do these resilience analysis. Any other questions that anyone may want to take? For example, the one on the predictive use of indicators. This is a tricky one. Any thoughts, Milena?
Yeah, if I can add also, looking at what happened in Italy, let's say that during the pandemic also the Italian healthcare system changed or introduced a new way of collecting data. So for instance, we counted not only the number of beds in intensive care units, but we introduced also a new code to measure, for instance, beds for ICU. So they changed also the way to counting data in terms of prediction, or which are the indicators that could predict a resilient way of a country to the next pandemic. We discussed it quite a lot also at the Italian Ministry of Health during in the panel of experts for the palm flu, so how to monitor the pandemic flu plan. And while there were many people that want to introduce or keep on looking at simulation, which is one of the, for sure, best practice to learn and adapt and make the system really resilient in terms of behavior. On the other side, we can use some KPI. For instance, we can introduce vaccination coverage for vulnerable people. Not only vaccination coverage related to mandatory vaccine, but also, for instance, vaccination coverage for flu for healthcare personnel. So it was awkward, but we didn't really measure at the Italian level the number of healthcare workforce that were covered in terms of vaccination flu, as well as we can. There's no way of measuring, as Melanie was saying, also how many people in the nursing home are covered for the vaccination flu. So these are, let's say, one of the best indicators that could be used also and could be also monitored during time through the HSPA. Others related to the healthcare staff, for instance, are related to the satisfaction of healthcare workforce, because after the pandemic, we are looking and facing also many healthcare workforce that are quitting the public health system. And so let's say that not only we need to acquire healthcare workforce, but we need also to retain them.
Thank you, Milena. That's really fascinating with the to have KPIs that are sort of specifically in place to look at, to have a sort of predictive element to it. And of course, simulations with existing indicators is, if we have resources and capacity, is always something that's nice to do. We need to wrap up. We're coming to the end of our webinar. Before I do so, I'd just like to look at any of the speakers, any final thoughts that you'd like to bring across. And if not, then we'd like to come to an end of this webinar. I'd like to say that we've looked today at resilience, not as resilience in and of itself, but really resilience as integrated into health systems performance assessment. And I think we see that really it's about looking at any indicator really, if we have the data and if we have the health systems performance assessments in place in countries, then we can really look at any indicator in terms of what was happening before a shock, during the shock, and after the shock. And I think that's sort of the overall key message that I'd like to take you home with, to have you go home with. We will have several webinars in the next few weeks, so please watch this space in the future. We have a few on workforce, we'll have a few on cancer policy, all coming up in the next few weeks and months. So thank you so much, and I'd like to say goodbye.